Thank you, Madam Chair. Let me just give you first a quick look at the thumbnail sketch of where we stand in Pennsylvania. Our situation not quite as rosy as Minnesota. In the last 7 years, from 2000 through 2006, healthcare inflation has risen in Pennsylvania by 75%. Regular inflation, healthcare premiums have risen by 75%. Regular inflation, 17%. Median income has grown by 14%. So you can see just how fast small business or all business employers have fallen behind the healthcare premium rate of growth, and how the employees who contribute have fallen behind. Their buying power is much, much less than it was 7 years ago. I would submit to you that if we fast forwarded to 2013, the next 7 years, and those statistics continue, healthcare as we know it in Pennsylvania, and my guess is in almost all of the states represented by this panel, will be over. There will be no employer-based healthcare in the United States of America. I think that is unsatisfactory and wouldn't be a good result for us. In Pennsylvania, we have, good news is we have about 92% of our people covered. Bad news is it's 800,000 adults without coverage, a little less than 150,000 children. Of those who are uncovered, 74% of them work, and the vast majority of them work for small businesses. And I'm using the federal definition of small businesses, 50 employees or less. 27% of them have been uninsured for at least 5 years. Premiums for employer-based health care rose in 2005 by 9.2%. It was the 5th straight year that premiums increased by at least 9%. In less than 10 years, the average cost for premiums for family coverage in Pennsylvania through employer-sponsored health care has gone from $4,800 in 1996 to $11,400 in 2005. During that same period, if you were just trying to insure your employee, coverage went from $2,000 to $4,600. Stunning increases. And the most stunning fact of all, Pennsylvania is second only to California in the number of citizens who between 2000 and 2007 have lost employer-based health care. 491,000, effectively 500,000 Pennsylvanians have lost employer-based health care in the last 7 years, second only to California, as I said. Now, what can we do about it? I think what we have to do is take strong and decisive action, do it quickly, do it smartly, and I believe the answer is a combined federal and state program. But let me tell you a little bit about what we have tried to do in Pennsylvania. You've heard Congressman Sestak said, and the chairwoman said, we have a plan called Prescription for Pennsylvania. It has 3 components, all equally important. The first component is to contain and drive down costs. If we don't do that, nothing else we're designing here will matter, because Governor Pawlenty used the vacuum analogy, because everything will be swept away unless we can contain and reduce certain costs. We believe we can do that. The second component of our plan is to cover all Pennsylvanians. But if you did that, the average premium for a small business or a large business would drop by 6.2%. If we covered all Pennsylvanians, it would save the healthcare delivery system $1.2 billion in Pennsylvania. 6.2% reduction in that small business's premiums. And I want to keep those percentages in mind. Second thing we want to attack is medical errors, and we're attacking them in a number of ways. As I said, in our Medicaid program, we're stopping paying for obvious and preventable medical errors. We want big businesses to join us in doing that. Preventable medical errors cost $2.1 billion, about a 10% reduction in premiums if you could get rid of all of them, and I know you can't. Hospital-acquired infections, I think Congressman Sestak made reference to that. We require our hospitals to report the level of both medical errors and hospital-acquired infections. Last year, there were $4 billion of hospital-acquired infections. You know what that is. I come in for an appendectomy. I'm otherwise perfectly healthy, but I get infected by something that occurred inside the hospital. It's stunning. The average cost of hospitalization in Pennsylvania is $32,000. If you get a hospital-acquired infection, the average cost is $180,000. Are hospital-acquired infections, and you've all now heard about MRSA, are they preventable? Yes, they are. And Scandinavian countries have pretty much zeroed them out. They are preventable. Some good work is being done here. The Pittsburgh VA, Congressman Altmaier, is the leading Veterans Administration hospital in controlling hospital-acquired infections. They have an interesting protocol, which I don't have time to tell you about, but over the course of the average stay, that protocol costs $377. It's masks and gowns and hats for everyone who comes within a certain amount of the patient. It costs $377. So you pay me now $377 per patient, or you pay me later $150,000 per patient.